Hello, welcome to the Healthcare and Assisted Living Overview. My name is Alicia Hartnett. I'm the Director of Healthcare Services and the Licensed Nursing Home Administrator here at Miller's Grant. I oversee the day-to-day operations of healthcare and assisted living with the support and valued input of the rest of the interdisciplinary team. So we're going to go through and just go over what is healthcare and assisted living, some key team members, and a little bit of information you'll need to know along the way while living here at Miller's Grant. So first we're just going to go over what is healthcare and what is assisted living. So healthcare can be short-term rehab, long-term care. The long-term care is going to more so be your quote-unquote nursing home or extended care facility, where we'll help with any disability of the advanced age. Maybe it's a terminal disease, chronic illness, but we do also assist and help residents who may require medical services and nursing services, more in line with rehab, which might be your short-term skilled nursing stay covered by Medicare. So that's our healthcare center portion. Assisted living is a way to provide care to people who are having difficulty living independently. We provide and furnish a place to live, meals, assistance with activities of daily living, such as dressing, bathing, eating, and medication management. And we do follow certain regulations, a little less regulated than our healthcare center, but regulations nonetheless. So what are these regulations? We might refer to them as COMAR, the Code of Maryland Regulations, but it is something that is in conjunction with the federal requirements. We are also governed by the Maryland Department of Health, and more recently, County Health Department and the CDC, CMS with all things COVID. So these Code of Maryland regulations do apply to the healthcare center and assisted living. So let's meet the team. Healthcare and assisted living do share a lot of their key leadership staff. So you have a director of healthcare services who oversees the day-to-day operations of healthcare and assisted living, as well as Diana Lauderer, who is the director of nursing and delegating nurse. She is the clinical counterpart to the director of healthcare services. Samantha Grove is the administrative nurse who works hand in hand with Diana. Sheethal Patel is our director of rehab. Tammy Hay is our life enrichment director who oversees programming in both healthcare and assisted living. Casey Revest is our social services coordinator, and Chelsea Wagner is our administrative assistant and also staffing coordinator. For you, in terms of this overview and much of our admission process, Casey Revest is a key component, as well as Jenna Britton, who is the RN care coordinator, who I'm sure most of you know pretty well at this point. This is a floor plan of just what the healthcare center looks like. I will note that healthcare and assisted living very much mirror each other. Going into the residencies, and then in the middle you do see the dining room and living room, these common areas that residents can share. More information about healthcare. So how many units do you have? Looking back, you can see that we have 5 semi-private rooms as well as 2 private rooms. In the semi-private rooms you are sharing a restroom. In the private rooms you do have your own restroom. Again, I will note there are 2 private rooms and 5 semi-private rooms for a total of 10 healthcare beds. So who pays for your stay when you're in the healthcare center? More often than not, you've come to the healthcare center from the hospital. You more than likely will need a short-term stay, which is covered by Medicare. Medicare will cover your first 20 days, 100%. Days 21 through 100 will be covered at 80%, and then your co-insurance, your supplemental would kick in. You're more than likely only going to need the healthcare center for maybe 2 weeks, which would be covered under Medicare after that hospitalization. You could also be in the healthcare center for a more permanent stay or maybe even hospice. So Medicare will cover your stay, Medicaid might cover your stay down the road, Of course, private pay as well. So how much does it cost? What's included? A minimum cost might be $385 a day for the lowest level in a semi-private room. You could pay up to $535 a day in a private room at the highest level of need. Your room and board is included in the private rate. And then you might have ancillary charges if you're a long-term resident on private pay, something like incontinence care, wound care, that is not covered because you're not under Medicare services. If under Medicare services, Medicare is maybe more looked at as an all-inclusive rate where everything's included. If you have any questions, you can always contact me, Alicia. Also, Casey and Jenna are great points of contact. Assisted living, as I noted, is very similar. There are 1 bedrooms that you have your own bathroom, and we also have private rooms. I will note that 1 bedrooms can share occupancy, so you could have 2 people in the 1 bedrooms, maybe a husband and a wife. In the studio, it is only licensed for 1 person. We have a total of 20 units in assisted living. 4 studios and 16 1-bedrooms. That's for a total of 36 licensed beds. So if we have couples in the 1 bedroom, that's how we get more than the 20 units. In assisted living, the paying is a little bit different. You can pay in assisted living through private pay. You can utilize your long-term care insurance benefits in order to pay for your daily rate. Your lowest rate in a studio at the lowest level of care might be around $293 a day. At the highest level of care in a 1-bedroom, your cost might be $344 a day. We can provide items regularly, which then are billed. This might be toiletries, briefs, or these are things that you can actually, or your family can provide. We've even had a lot of residents with something like incontinence products or briefs actually send them direct from Amazon, and they come regularly. That way you don't have to worry about it. Who do you contact again if you have questions? Myself, Jenna, or Casey. These are some of our key providers in the healthcare center. I will note that because the healthcare center is more regulated, we do have more regulations on who can provide what services. Our medical director is Dr. Tezu Wolokoli. She provides oversight to our clinical team, and she monitors the attending physicians and their compliance. She's a great expert and oversees other facilities just like ours. She helps us monitor for any risk and even reviews charts as needed. Dr. Wah is the attending who comes in regularly to see the residents. For frequency, it might be on admission, monthly, and then every few months or as needed. Dr. Wah may not be your attending while you're here, but his nurse practitioners come into the building often and are under his direct supervision. As I was talking about regulated providers, the pharmacy is one of them. It is a COMAR and is required for the healthcare residents to utilize Remedy Pharmacy. This is because they are required to provide monthly drug regimens and reviews, and the frequency is a regulation. We have other services that you might already be familiar with. Med Options is a psych service that we do utilize from time to time. LabCorp is our lab for any blood draws or urine specimens. Trident Care is our mobile imaging, so they'll come in and do a chest x-ray. And you also have still the medical suite providers such as podiatry, audiology, and mobile dentistry. So all of those providers are at your disposal in the healthcare center. Assisted living is somewhat similar. However, the attending physicians in the pharmacy can be at your choice. So if you see Dr. Abbas in the medical suite, he can continue to follow you in assisted living. That's one of the great things about this continuum, is that someone like Dr. Abbas could follow you into assisted living. If you have an outside provider, we'll just want to have an agreement and their commitment to see you in assisted living. You can opt to use your own pharmacy in assisted living. So if you use a local pharmacy, Giant, what have you, you can utilize those pharmacies. It is at the resident or the POA responsibility for filling prescriptions and getting them to the nurse. There also is a $35 a month charge if you wish to utilize your own pharmacy rather than using Remedy. And again, same providers, MedOption, LabCorp, Trident Care, and the same medical suite providers. One of the biggest questions we have is, what if there is no bed available, whether it's in the healthcare center or assisted living? If I need a higher level of care and there's no bed available, what do I do? When Miller's Grant's aware that you are hospitalized, say for a fall or an elective procedure, and you need to utilize a healthcare bed, the social services coordinator, Casey, and the care coordinator, Jenna, will reach out to you. They will be in touch with the case manager at the hospital, and if not you, maybe one of your children or a friend who might happen to be your healthcare power of attorney. If there's no bed available at Miller's Grant, we will help coordinate placement at another facility. We do very much realize that it is a small census, a small footprint, and beds may not be available. So we do want to be very proactive in making sure that your discharge from the hospital is just as streamless as if you were coming here. So we very much want to help you with that transition. If you should go to another facility and we have a bed open up and you are willing to transfer, we will work with that facility to bring you back home if a bed becomes available. Of course, we always recommend Carroll Lutheran Village. They're our sister community. We have a very good coordination of care between both. My position down here works very closely with the Director of Healthcare Services at CLV, and similarly with the social services team. They work very closely and can help with that continuity of policies and procedures, even billing. All of that is just a little bit more manageable when we're doing it between our communities under LSMMD. But we do want to make sure that you understand that if there's no bed available, you do have the support of the social services coordinator and Jenna, the care coordinator, and even myself to help you coordinate your discharge from the hospital. If there's no assisted living bed available, same thing. We can transfer you somewhere temporarily and help with that placement or find a place that can best suit your needs. If you should have any questions, please don't hesitate to reach out to me. I have provided my phone number and email. Lastly, a great resource for any resident within Miller's Grant who has questions, please feel free to reach out to the healthcare committee. They're a good resource for information and directing you to the appropriate staff member. I can't thank you enough for joining me today. If you have any questions, please feel free to reach out and we'll talk soon. Thank you.